Everybody, welcome to our first day of the main conference. Some of you were here last week doing the pre-licensing, so welcome back for those of you who were there. We're so excited to have you. We have several sessions today, several sessions tomorrow, and 2 more on Wednesday. Lots of exciting content this year, as always. So really looking forward to everything you're going to learn and hear from these great speakers. Before we get to that, some acknowledgments and just some information for all of you. So first of all, I'm Allison Espeseth. I'm the Director of Covering Wisconsin. This is our 12th year, if you saw on the intro slides. Believe it or not, we've been doing this since 2013, and I think it's really just been so powerful to share all this really important information for enrollment assisters, navigators, certified application counselors, as well as some agents and brokers here who also can get their continuing education credits through this. We have over 320 attendees. I know it's more than that, actually, since we last took a formal count and shared that on the intro slides. So super excited about that as well. I want to thank, we do this really just hand in hand with the Department of Health Services here in Wisconsin, as well as the Office of the Commissioner of Insurance. Just really, this both makes sure that you can get your education credits for the licensing overseen by OCI, but also just the content for Medicaid programs that DHS oversees. I want to also thank our sponsors this year. We have UW Health, United Healthcare, Common Ground Healthcare Cooperative, Molina, Newark Health, Security Health, Chorus Community Health Plans, GHC of Eau Claire, GHC of South Central Wisconsin, and the Wisconsin Hospital Association. So thank you again, sponsors. Really appreciate the support for this event and making it possible. Also look at the end of today's sessions. Just today, we'll have a virtual exhibit booth from United Healthcare just for half an hour from 12 to 12:30, where you can just visit with a representative there. As you can see, for those of you who attended last year, we're using the platform hosted by the UW Conference Services again. So I want to thank that team for their support in making this possible. We only use the Q&A function on this platform, so we don't have a chat enabled. If you have a question, please do use that function. That's what we monitor, and we will respond to either live, or if time runs out and there's lots of questions, we'll sometimes also follow up with those and post them on our website. And if you have any technical assistance, the Q&A function is really not the best place to put that, because that's really just monitored by speakers and folks like me who cannot necessarily help with technical issues. There is a technical support button at the right-hand side of your screen, so just click on that and somebody from the UW Conference Services can help you out. So today we have 3 sessions. We have this morning's opening plenary, which I'll introduce in just a moment. We then also have a session on transitioning from coverage from employer-sponsored insurance. And then finally today we have a panel of qualified health plan executives. Between each session, there'll be a 10-minute break. On this platform, you will need to leave the session, go back to that main screen that you first entered in on when you first logged in, and then just click on the next session, and then you'll go into that one. But like I said, there will be a 10-minute break, so you can just step out, get a snack, whatever you need to do before we start up again. So this morning, I'm excited to get us started. and also to introduce our speakers as well as our guest moderator that we have this year. So our guest moderator is Tricia Brooks. She is a research professor at the Center for Children and Families, a part of the McCourt School of Public Policy at Georgetown University. So Ms. Brooks is a nationally recognized expert on Medicaid and CHIP eligibility, enrollment, administration, and the quality of healthcare. She's a second-term commissioner in MACPAC, an independent commission that advises Congress, the states, and CMS on issues affecting Medicaid and CHIP. And prior to joining Georgetown, she administered the New Hampshire's CHIP program and managed the state's Consumer Assistance Hub. And Tricia will be joined by our two speakers, so Bill Hanna and Becky Easlin. Bill Hanna was appointed as Wisconsin's Medicaid Director at the beginning of this year in January 2024, subsequent to serving as Wisconsin's Deputy Medicaid Director. He has 15 years of Medicaid expertise at both the state and local levels, including previous work at the Wisconsin Department of Health Services, Dane County, and Portage County Human Service Agencies, and the DC Department of Healthcare Finance. Bill was a regional director of growth and strategy at United Healthcare, supporting Medicaid HMOs in Virginia, Maryland, North Carolina, and Florida. And finally, Rebecca Easlin is the Deputy Commissioner of Insurance at OCI. As Deputy Commissioner, Rebecca is responsible for the overall operations of OCI and actively participates in the National Association of Insurance Commissioners activities and engagement with stakeholders. Before OCI, she served as Senior Policy Advisor with the International Association of Insurance Supervisors, and prior to that, Deputy Commissioner Easlin worked at OCI for over 15 years as a financial examiner and the Director of Financial Analysis and Examinations Bureau. So with that, I'm so pleased to welcome Tricia Brooks to the stage to get us started.
Thank you, Allison. It's a pleasure to be back for your annual conference, and good morning, everyone. As Allison said, when I ran the Healthy Kids program in New Hampshire, we were the Consumer Assistance Hub, and we provided the training and support to our community-based assisters. So I know firsthand how critical your work is in connecting real people to coverage that meets their needs. So welcome. While I know that you are all focused on Wisconsin, I'd like to take a couple of minutes to talk about the national landscape and the marketplaces. We all know that there are high stakes pending the outcome of the national elections. The two candidates have drastically different positions on healthcare, which will impact our work ahead. And I'm happy to answer questions on this later, but I want to make sure that we have plenty of time to hear from Bill and Becky about the work they are doing and what their agencies are doing. But regardless of the outcome of the elections, the additional premium tax credits that have been in place for a couple of years will need to be reapproved before the 2026 plan year. And without action, premiums could increase significantly, in some cases for 4 million people, including over 235,000 Wisconsinites. But the big news in the past year, of course, is that Medicaid has undergone an unprecedented event in the COVID-related continuous coverage requirement and unwinding it. The unwinding revealed that there's a lot of work to be done in most states to be fully compliant with federal renewal regulations. And over the coming months, steps to ensure that they are following all the Medicaid rules and promote coverage of eligible children and families. And there are many lessons to be learned from in the share of renewals that Wisconsin and other states have been able to renew on an automated basis. And Bill will have more to say about that. Another reflection is that we still share of enrollees who many of those, more than 250,000 disenrollees in Wisconsin, may still be eligible. The Office of the Assistant Secretary
35% of disenrollees would remain eligible, including 3 out of every 4 children who were disenrolled for procedural reasons. So hopefully your efforts in critical roles as navigators and assisters during the
upcoming open enrollment period will help reconnect them with coverage. But before we hear the message
specifically for you all as navigators and assisters, an update
on Medicaid.
and we are just waiting on the video to begin.
I wanted to take a moment to thank everyone who has played a role in supporting Wisconsinites enrolled in our state's Medicaid programs over the past year. When the pandemic hit, Congress called on states to help ensure folks on Medicaid could keep their coverage and have peace of mind that if they got sick or hurt, they would see a doctor and get the care they needed. During that unprecedented period, more Wisconsinites turned to our state health care programs, increasing enrollment by nearly 500,000 people. Through these programs, they still could get care for illnesses, injuries, and chronic diseases. They could get care during pregnancy and access well child visits for their kids. They could take advantage of mental health services from their homes using telehealth. Badger Care Plus and our other Wisconsin Medicaid programs were vital lifelines for more than 1 in 4 of our friends and neighbors. But in 2023, these temporary policies ended, and states are asked to start transitioning back to normal operations. That put a huge job on all of you to help more than 1.7 million people in our state keep their state healthcare coverage. But thanks to you, Wisconsin was ready. In total, Wisconsin processed 1.2 million renewals following the end of our temporary COVID-19 policy statewide. And today, total enrollment is about 110% of what it was before the pandemic began, with 1.3 million Wisconsinites relying on Badger Care Plus or one of our Wisconsin Medicaid programs to make sure they and their families have access to health care. That's a big deal, folks, and our state is stronger and healthier thanks to your service over the past year. It made a real difference in the lives of Wisconsinites all across our state, and your work does not go unnoticed. So on behalf of the state of Wisconsin, thank you for stepping up to take care of your neighbors and keep our community strong. With that, thank you and take care, folks.
Well, I know we're having a little bit of technical difficulty with Trisha. We're going to give it maybe just a moment. I think she's going to try to switch to a different Wi-Fi connection. But I think what we could do is just go ahead and shift over to Bill Hanna. I know he has prepared some opening remarks. And then maybe during that time, we can go ahead and get Trisha back on. So I'm going to hand it over to Bill. And while you are just introducing yourself again, I'm going to pull up your slides. So just give me a moment.
Good morning. Thank you, Allison, and hopefully we can get Trisha back. First, let me echo the governor's remarks and say thank you to all of you. This has been an unprecedented time for Medicaid, and we did quite well in Wisconsin. And a big part of that is because of you, because of the work you did, making sure people were informed and had the assistance they need to make sure that they maintained their Medicaid eligibility. As Allison shared in the beginning, I'm Bill Hanna. I'm the state Medicaid director, and this is my second time at DHS. And I feel privileged to be able to present to you today. I started with the department in 2013, and my very first job as director of area administration was to travel around the state and talk about the Wisconsin version of Medicaid expansion and set up regional enrollment networks. I worked at the department from 2013 to 2016. I moved out of state for a while, and I'm very happy to be back and very happy to see that regional enrollment networks are still going strong and playing a vital role in making sure individuals have the information they need to get access to care, whether that's in Medicaid or in the marketplace. I want to talk a little bit about how we did throughout this unprecedented Medicaid unwinding. The attention of Medicaid eligibility has probably never been higher, both in Wisconsin and nationally, from policymakers, from the media, and from members. And Wisconsin was ready. I have to give credit to past Medicaid directors, several Medicaid directors ago who started early, who by working with partners like Covering Wisconsin, regional enrollment networks, we knew at some point the temporary policies were going to end, and starting early, building a task force to engage the department and you all to hear what was actually happening on the ground was critical to us being able to pivot once unwinding started. So let's talk about the big picture and just look at some numbers. I don't know if we have the slides available. Oh, are the slides? Great, thank you. So you see throughout the unwinding period, we continue to improve. And I'll tell you the metric that I've very much focused on and want to continue to focus on is that red line. That red line is procedural disenrollments. We cannot control the life circumstances of an individual. And if their circumstance changed during the pandemic such that they're no longer eligible for Medicaid because their income improved or their health improved, that's a good thing, right? We want people making more money, being healthier. What we can control and what we really want to drive down is that procedural disenrollment. Those are individuals who lost coverage, not because they were ineligible for the program, but because they didn't return some information, some documentation so that we could test their eligibility. And you see in those first couple months, renewals were new. We were at 28% of those months. People lost coverage for procedural reasons. That's not good enough. And so we continued to work to try to drive down that number. We made some changes to administrative renewals so that people could be renewed without having to return documentation. We also adjusted our policies based on federal guidance to do administrative renewals at the individual level instead of the household level. You see towards the later half, the last quarter, we've cut that number in half. Our procedural disenrollments are now down to 10 to 12%. What's going to be important going forward, and we at the department will continue to monitor, is what happens to that number as we now go through sort of the second round of eligibility renewals now that we've gone through this first version. We will continue to update this information on our dashboard as we move forward. Looking at the big picture, and as Governor Evers shared, from March of 2020, when the pandemic started, to May of 2023, right before unwinding started, we gained 477,000 new Medicaid members. Since May of 2023 through June of 2023, Wisconsin's Medicaid enrollment has decreased by about 350,000 individuals. That's from our peak enrollment during unwinding. Another way to look at those numbers is we are 128,000 individuals above where we were before the pandemic. It's really hard to put a value judgment on which number we want to look at. We certainly know there were some individuals who enrolled during the pandemic who no longer need Medicaid. If we have to remember what the world was like in 2020. Restaurants were closing, businesses were closing, gig workers had less work. People didn't have a lot of options at that point. Now we fast forward 3-4 years from now, people are working again. And again, that's a good thing, and we wouldn't expect those individuals to stay. At the same time, we knew before the pandemic that there were some individuals who should have been on Medicaid, who weren't, who didn't know about it, who didn't know how to get on. We've certainly picked those individuals up, and we've maintained them because we haven't had the churn, the disenrollment and re-enrollment throughout the pandemic. What's going to be important going forward is that we maintain that information and we stay on top of that churn, and that people remain eligible, and we have fewer and fewer ineligible or procedural terminations. If we could move to the next slide, I want to talk a little bit about some of the things we developed throughout the pandemic, some of the changes we made, and how those changes will continue going forward. I think the biggest focus is our new attention to data and transparency during the renewal period. We built many new reports and have many new organizations, including covering Wisconsin, our health plans, providers, to provide more information to those organizations during a renewal period. Now those organizations will get a monthly list of who's up for renewal in the next 60 days so that they can do outreach prior to their renewal. They'll also get information during renewal to see, have those individuals started the renewal process, and we'll get information if an individual did not complete their renewal so that they can do outreach post their renewal period and do follow-up, because of course we have a 3-month retro enrollment period to reach out to those individuals and make sure they stay covered. We will continue that data sharing going forward with any interested party that used that during the pandemic and would continue to use that information going forward to reach out to members. The other thing is we've built a public dashboard. I'm sure many of you have looked at it. We will be maintaining that public dashboard. I will caution, we have paused the updates right now because during the pandemic, we were manually updating that process. We knew that data was critical, that it was timely. We are in the process right now of automating that data so that it is an indefinite and ongoing source of information to really track how are we doing this second time around and not lose focus on all of the work we've done in eligibility. So using that data, we sliced our data around many different factors. We've sliced it based on region. We sliced it based on race or ethnicity. And in all of those areas, we saw pretty consistent trends. They all sort of followed the same norm. The slicer, or the way we split the data, that really resulted in significant differences that we saw in our data was when you slice it by age. And I think the results are probably not that surprising to you if you've worked in this space for a long time. We saw kids and older adults, 65 and older, had the highest percentage of maintaining eligibility and the lowest percentage for procedural disenrollment. Conversely, the 19 to 26-year-olds were the population where consistently they had a much higher procedural disenrollment than retention rate. I actually saw in your conference, you have a whole session on these young invincibles. And as well as the work you will be doing, there is work that we are doing at the department to better engage this 19 to 26-year-old population. I think part of this is an information gap. We often hear out in the public, in the media, right? You can stay on your parents' coverage till you're 26, but that's not true in Medicaid. And that's the part we don't share, right? Because when a child turns 19, they have to apply on their own. And we haven't done a great job of making sure those individuals, those young adults, and their families understand that there is a step that they have to take when they turn 19. This was compounded during the pandemic because, of course, we had individuals who turned 19 in 2020. So by the time we started doing unwinding, we had 19 to 23-year-olds who used to be covered under Medicaid with their parents and needed to do their own application. And I think we have an opportunity to increase our efforts with that population. If we want to go to the next slide, we'll talk a little bit about some of the things the department is currently working on to target that population. First, we are in the process of going back and trying to catch all of those, that cohort that were procedurally disenrolled. We have letters going out to that population in batches of about 2,500 every 2 weeks. So this will go through mid-November. So far, thank goodness, our returned mail rate is only 2%, which is, again, a big credit to you all. We did a huge effort in making sure we had correct information for individuals. So we have the letter available so that you all can see what that letter is. We've also made a flyer that we are working with our IM agencies that they can use and put up in their offices when they are talking to families. These letters are going not only to the individual. Going forward, we will continue doing these letters. As a child is about to turn 19, the letter will go both to the individual and to their family, because we know, and we learned this during the original sort of Medicaid expansion and Obamacare, is that young invincibles, it's about a trusted individual, and there's nothing like mom to get you to do that work to make sure you maintain that eligibility. And so we are targeting this effort to really try to improve our retention rate for 19 to 26-year-olds. We can move on to the last slide. I want to share a little bit of some exciting news that we learned about 6 months ago or so. McKinsey, this is a national consulting firm, did a statewide evaluation survey of national survey of individuals' experience with government across all sorts of government services, from taxes to parks to Medicaid and SNAP, asking individuals about their experience and how they would rate their experience engaging with government. And when you look at the Medicaid eligibility question and you rank the states, Wisconsin was #1. We had the most satisfied population for that Medicaid experience. But that top score was that only 46% were highly satisfied. So while we are #1, there is room for us to grow in improving how we engage individuals in the Medicaid renewal or application process. This has been a consistent focus of ours as we look ahead at what's next. Not surprising, in that survey, 3 key pieces that individuals shared that they thought was important to good government service. 1, reliable and consistent information. Don't we all want that? Nobody wants to be working towards a process and then hear the rules are different. So we're doing some things to make sure that happens. 2, courteous employees. We all want that, especially when we're engaging through some sort of process that is confusing. that requires a lot of paperwork that you may not understand. And third is transparency. People want to know what's going on. They don't want to put stuff into a black box and then wait for days or weeks or months to find out what happened. So there are 4 specific changes we are working on right now to sort of close some of those gaps. First, we're adding what we affectionately call the pizza tracker. You know, nowadays, everybody wants to know where we are in the process. You order something from a pizza shop or from DoorDash, you see where you are in the process, and you get an update when your order's been received, when your order's been picked up, when the driver is approaching. We are doing something similar in our Medicaid application so that people know, hey, I submitted my application, and they can go on their access site and see, yes, their application is received and somebody is working on their case, give them an estimate about how much time it would take. When we send out a letter, we say, oh, the process is with you right now. So they know what they have to do. Half of our calls during unwinding were, did you get my application? Where's my application? Checking on the status of their application or their renewal. It's important to people. It's their healthcare. And so in this way, we can be more transparent. People can have more self-service. It reduces our call volume, which allows workers to spend more time processing cases and less time answering calls when we create this self-service that many people are used to having in all sorts of functions. So we are excited to move forward with that tool in the access tool. 3 other changes we're making really around reliable and consistent information. We are adding new technology, using intelligent design. We are adding intelligent document processing, which cuts down on errors in terms of transferring information. We are adding a caseworker policy assist. We know some of our policies are quite complex, and we are using technology to quickly and efficiently be able to search many of our policy manuals so that workers can find the right information at their fingertips. We are in testing phases right now, but this is really machine learning so that we can get accurate and consistent information using our source data, our policy manuals. And third is a similar function for customers, a customer virtual assist, so that they can also get consistent and reliable information through a search function. And then lastly, courteous employees. Our new director at Miles has put a major emphasis on customer service. He came in and noted that our Google scores at Miles were 1 star. And he said, which makes perfect sense, he said to our team, would you eat at a restaurant that had 1 star? Would you go to a business that had 1 star? No, you wouldn't. And people don't have a choice. Miles is the only option. We can do better. We can pay more attention to how we engage our customers. That focus on customer service we've already seen positive changes. If you look at the Google scores of Miles, they're over 4.3%. You see customers writing in about specific employees, and they're going above and beyond to help people. We want to continue this focus, this effort on really being a customer-driven organization. Again, you have to use Miles. You don't have a choice, but we should measure ourselves against any other organization, and people should expect that same level of courteousness from government employees. I'm going to pause there. I know we have Becky's going to talk a little bit about what's going on OCI, and then Tricia has some questions. Again, thank you very much for having me here, and I look forward to continuing the conversation.
Thank you, Bill. And I apologize for my blip there. I believe in the same hotel that Bill is for the National Academy of State Health Policy Conference. And internet was not happy with me. But Bill, I love what you're doing on customer service. I think that is just fabulous because I think it makes all the difference. And it certainly your customers are not only people who are trying to enroll, but they're also the navigators and assisters out there who are trying to help people with complex cases. So that focus is really wonderful. Before we turn to Becky, we do have a polling question. Have you encountered a consumer or patient who has been impacted by an unauthorized enrollment in the marketplace? And I know Becky's going to talk a little bit about this and what's happening at the national landscape. Are we going to get that polling question up?
Yeah, I believe it is available and looks like people are responding. So we'll give them maybe another, 15 up to 30 seconds just to think about that. I know some people are still gonna think through just some of their client base and maybe if they've seen that or not. And then we can stop the poll and see how people responded.
Okay, Allison, I can't see the poll, so you'll need to tell us what the results are.
Yeah, I will do that. And looks like maybe just a few more seconds here and then we can end it. All right. So let's close that and share the results. So it looks like most people said that they had not, so 48%. But just under that, 41% said yes. And then split 5% both for maybe and 5% for what is an unauthorized enrollment. So there are some folks who would love to learn a little bit more about that.
Okay, well, I think we're on track to hearing about it from Becky here now. So Becky, what's happening at OCI and tell us more about the collaboration between the Commissioner's Office and DHS.
Hi, good morning, everyone. Again, this is Becky Easlin, the Deputy Commissioner of the Office of the Commissioner of Insurance. And before talking about inappropriate enrollments, I just wanted to announce that earlier this year, we celebrated 5 years since Governor Evers launched the Department of Health Services and the Office of the Commissioner of Insurance Healthcare Coverage Partnership, which is known as the partnership. And since day one, Governor Evers has made healthcare access a priority, and this partnership has been an important piece of that. The partnership was tasked with supporting outreach and enrollment, improving coordination between DHS and OCI, and promoting overall well-being of Wisconsinites through greater healthcare access. And since its inception, the partnership has included representatives from healthcare and insurance providers, navigators, and agents, as well as consumer, government, and community organizations. We are grateful to partner like Covering Wisconsin for joining OCI and DHS in this important partnership to support enrollment access within the state. During 2020 open enrollment period, the first after the creation of the partnership, about 195,000 Wisconsinites enrolled in coverage. Now, during 2024 open enrollment period, we have 266,327 Wisconsinites signed up for health insurance on healthcare.gov. This is a 20% increase in enrollment from the prior period in 2023. The partnership launched wiscover.com as an accessible resource for consumers to get connected with enrollment information. The implementation of the Wisconsin Healthcare Stability Plan, referred to as WISP, has also contributed to increased enrollment. WISP has helped keep health insurance rates low while increasing choice for consumers every year. It has been in operation. Now, going back to inappropriate enrollments, in the wake of the unwinding, there have been some challenges with bad actors signing Medicaid eligible individuals up for marketplace coverage inappropriately. But we've been working closely with our counterparts in other states, stakeholders, and of course CMS to address this. Just to give you an idea, in the first 6 months, the agency CMS received over 200,000 complaints in the nation in regard these inappropriate enrollments. They're often driven by out-of-state agents and brokers, but we are taking action where appropriate within our regulatory authority to ensure that consumers in Wisconsin aren't harmed. And I just want to briefly mention, for those that are not familiar with the OCI, our mission is to protect and educate Wisconsin consumers by maintaining and promoting a strong insurance industry. And we continue to work every day to live up to that mission. As an idea, some of the major functions, we monitor financial solvency of the insurance industry. We ensure that insurance policies comply with Wisconsin laws and rules. We also are responsible for issuing licenses to insurers, agents, and pharmacy benefit managers, and monitor insurer and agent behavior to ensure compliance with state insurance laws. And also, it's really important that it's our mission to provide assistance and education to insurance consumers. And with that said, I look forward to sharing thoughts and insights into the individual market with you today.
Becky, sorry, I was on mute. I was looking at you saying I can't talk. Hello back to everyone. We are going to do another polling question before we jump into the discussion. And recently, I think there was a piece in Wisconsin Health News indicating that premiums are up by 8% in Wisconsin, which I'm sure is not making a lot of people happy considering the inflation that we have. So are you, as a navigator or sister, concerned about the cost of coverage plans in your area? And the answers are yes, definitely, somewhat, or not really.
And we'll give that maybe another 30 seconds or so. People are providing their responses, and yeah, would love to hear and see what people are seeing in their area. So maybe just another 10 seconds. All right. And most people said yes, definitely. So 60%. Under that was somewhat percent and not really at just 7%.
Very good. Thank you for that. And as I noted at the beginning, I think those advanced APTCs are going to be critically important, getting those renewed by Congress in the coming months, because as we know, there's a timeline before you get to the next open enrollment period and when the 2026 plans start. So let's hope that Congress can work through the gridlock and get this done. So we're going to move into a discussion with Becky and Bill. I have some questions for them, but I hope you have some questions as well. And please do put your questions in the chat. Bill, I'm going to start with you. It's my perspective. We've been following the unwinding across the states. I have my website, the Center for Children and Families, ccf.georgetown.edu, has a lot of detailed information about all of the states. And we know that the states that had higher shares of ex parte renewals, and let me just explain what ex parte renewals are for those who don't know the term. They're also called automatic or automated renewals. They're called administrative renewals, but they're when the state goes out and looks at the data that the state has available to it through the state wage database, through IRS, through the Social Security Administration, through unemployment, any number of sources of income, to check to see if someone is still eligible. And if they are, all we do is send them a notice to say you're good to go for another year. So yes, Wisconsin made significant progress during the unwinding. And I think you started out at about 6 to 8% of ex parte, and you're now over 40%, 42, 43% in the most recent months. But some states have achieved even higher ex parte rates, some even over 70 and 80%. Do you think Wisconsin can make additional improvements in its ex parte processes in the months to come?
I think in the months to come, I think changing ex parte processes is quite a systems lift. It is something we are monitoring. We do think it's important for us to get a new baseline, a new normal. Now that we sort of know what is sort of the current Medicaid cohort, is watching what that ex parte renewal percentage is with sort of a new baseline before we jump into making major system changes. I do think it's also important to note that our ex parte numbers do not include any categorically eligible individuals in our numbers. So there are individuals that are eligible by nature of certain categories. For example, foster children, right, are categorically eligible. There's no data sharing, data matching to determine their eligibility. Those are not included in our numbers. Not sure exactly how other states, if they do or do not, sort of include that in their percentage. So we are looking at really people that actually have to go through a data matching process to determine their eligibility. I think we've made great progress, like I mentioned and you did, right? Really increasing from 6 or 8% to over 40%. We also know that in any given month, this percentage changes because the cohort of people going through in a month changes. Some months have more individuals that are self-employed, which makes it much harder to do data matching. And so we try not to focus on any one month, but really look at that trend going forward. And it'll certainly be something we monitor going forward and trying to identify opportunities to make those changes. We also know that it's a political process, right? Different administrations view it differently. You saw how it was set up originally when administrative renewals were allowed under a different administration. And right, why we started with 6 to 8%. We think we've made, again, great progress in getting that up to 40%, and we'll look for opportunities in the future.
And I think the 40% is a little higher than the median across states. So you're still on the good side of the equation. So, but that work is really important because we know that we lose more people at renewal than any other time. There's churn during the year, but we lose people at renewal. And the more we can do to boost those retention rates, it's important. So I'm going to stay with Bill for a little while, and then I'm going to turn to Becky. But Bill, around the country, we hear from states that partnerships with the sisters, community health centers, and other providers, the variety of community-based organizations, were really essential during the unwinding. And it's not just that helping them get through the process, but the outreach and the communication. So building on the momentum of those partnerships, is Wisconsin thinking about collaborating with your networks to launch re-enrollment efforts? How are you engaging those partners in letting people know that it's not too late to come back in, particularly during the 90-day reconsideration period, when a new application is not required, only the information that was missing that you needed to make the decision? So what are you doing? I know that, your numbers look pretty good, but still over 250,000 people lost coverage for procedural reasons. So I know you mentioned a little bit of this in your comments that I was able to hear. Tell us more.
Yeah, absolutely. We're going to take what we learned during this unwinding period. We intentionally went through sort of a start, stop, continue, both internally and talking to partners about what they found most helpful during the unwinding period. And the number one thing was data. So we are automating many of our data processes so that there is transparency for assisters, for health plans, for providers. they know they're individuals. We, the state, it's really hard for us to connect to individual people. We're just a big administrative state, a monolith, right? We don't have that personal connection that you all have. And so sharing that data at the individual level is critical to us maintaining the success as we sort of go through the second term. The other piece is we stood up regular calls with provider or with sister organizations to talk about what's happening on the ground. How is the communication that the department is putting out, how is it being received by individuals? Are they understanding it? Should we pivot? Are there gaps? We are continuing those conversations and expanding them beyond just renewals, but also, do people know how to use their benefit once they're on it? Do they understand some of the complexities of some of our programs? For example, our MAP program, right? Premiums are back. They were off for a long period of time. There were no premiums. And so that's an emphasis right now, right? It's a change. It's a re-awareness for that population. And so we want to continue to use the network that we've built, having regular conversations to make people aware of sort of all sorts of changes that are happening in Medicaid. And there are always changes in Medicaid eligibility policy.
Yes, and you've got a lot more coming. I want the assisted community to know that in addition to what I mentioned about if a state identified some deficiency or shortcoming in the renewal process, they're going to have to fix that in the coming months. But you have a big set of regs. I think it was over 900 pages of new eligibility and enrollment regs that are going to align a lot of the renewal requirements for your non-MAGI, your disabled or elderly population, with those in MAGI. So I want you all to be aware of the tremendous effort that the department's going to have to continue to make to be, to do all these improvements while staying on top of what's expected at the federal level.
I would also add, Tricia, obviously, we don't run our own state exchange. We use the federal exchange, which makes data sharing with the federal government a little trickier than some other states where they run both the marketplace and the Medicaid side, and so have a lot more transparency. We've been talking, both OCI and us, with CMS to try to get more transparency on what happened to the Medicaid population that they're no longer Medicaid eligible. How many ended up in a marketplace plan? Recently, data came out that showed 110,000 Medicaid individuals did end up in the marketplace. So whether those were procedurally ineligible individuals or people who were found ineligible, we don't have that level of detail, but it is comforting to know that of the roughly 350 fewer people on Medicaid, we know roughly a third of them did move over to the exchange.
Yeah, that has been an ongoing problem for any state using the FFM. And we get frustrated in the work that we do because we actually know that there are kids in the marketplace that should be in Medicaid or CHIP, where there are stronger benefits and less cost sharing. So it's an important thing for us to continue to advocate for CMS to be transparent the way that you are in Wisconsin. I love the fact that you showed your renewal outcomes by children, by age. Those kind of demographic, slicing and dicing is really what helps you say, oh, this is the population we need to target in order to get, work harder to get them in. And I really appreciate what you're doing on the young invincibles, if you will. I want to turn to maternal health for a moment because Wisconsin is one of only 2 states that have not embraced the state option now to provide 12 months postpartum coverage. CMS has not approved any extensions that are less than 12 months. The Wisconsin Senate passed legislation to adopt a new 12-month option. So what are the prospects for Wisconsin moving forward on this?
Yeah, it's disappointing. So we did get legislation that directed the department to submit a waiver for 90 days, up from 60. CMS has informed us that they will not approve that. To your point, Tricia, they basically said, look, you have the option to go to 12 months, and that's CMS's expectation. In Wisconsin, we are not allowed to submit things like this without legislative authority to do it. As you mentioned, Senate Bill 110 passed the Senate last session 32-1 and has currently 66 co-sponsors in the Assembly of its 99 members. So we have a majority of individuals, both Republicans and Democrats, that want to do this, yet we can't get it across the finish line. We'll see what happens in November. Obviously, there's a national election. There's also state elections for all members of the Assembly and half of the Senate. And we will push again sort of in next session to see if we can't get that legislation passed. It's important to the department. I know it's important to Governor Evers, and we will continue to try to get that 12-month postpartum legislation passed.
Yeah, it was a big win nationally. I've been in the Medicaid space for 30 years, and I've not seen any option like that get picked up with the way that it has across the nation. So hopefully we can put Wisconsin in the checkmark column on that one. So one more question. Wisconsin, like all states, was required to implement 12 months continuous eligibility, but a dozen states are moving forward on multi-year continuous eligibility, largely focused on young children during early childhood. We know how important the development is during those early childhood years. Is this something that's on Wisconsin's radar?
It is something we're talking about, but as you know, Wisconsin's also one of 10 states that hasn't done full Medicaid expansion. And when we look at sort of the political push, because all this needs legislative approval, and this has been a top priority for Governor Evers, top priority for the secretary, is getting Medicaid expansion done. If we have to take a trade-off between those two, Medicaid expansion is critical, especially as you've pointed out, when those additional tax credits go away, and it makes so we have people that are between 100 and 138 in the federal exchange, and when those additional credits go away, the affordability problem becomes even worse, right? For individuals that really are eligible for Medicaid. And our push really is Medicaid expansion. Let's get it done. I think there's a lot of misinformation in Wisconsin. Wisconsin has already expanded Medicaid. We did it almost a decade ago. We just didn't finish the job. So let's get it done. And we did it with our own money. If we went to the full 138, the federal government pays 90% of the cost to cover childless adults. And today in Wisconsin, because we only went to 100%, the federal government only pays 60%. So Wisconsin taxpayers are paying 40% of the cost when they could only be paying 10%. Over the past decade, that has cost Wisconsin taxpayers $2.4 billion. $2.4 billion of Wisconsin taxpayer money that could have been used for really anything. It could be used for education. It could be used for roads. It could be used for a tax cut. It doesn't have to be tied to healthcare. Would we like it to be? Yes, but it doesn't have to be. And so we as Wisconsinites are really subsidizing other states by not finishing the job. And when we talk about finishing the job, we are not like many other states like North Carolina, who added 600,000 individuals with expansion. We're talking about just 90,000 individuals. And if we did that in this next session, Wisconsin would earn over the next 2 years $1.6 billion back into Wisconsin and $300 million a year ongoing in savings. So when we are really focused on Medicaid and eligibility, that is our number one target, that we get the job done. We hear feedback that expansion is a disincentive to work. And that's just not true, especially when we're talking about the population that we would be expanding for. These are individuals who have income over 100%. They are working. We also know we have a workforce shortage, especially in healthcare. And we know, I've heard providers, individuals say, I can't take more hours because I will lose my Medicaid. I don't fault anybody for making that decision, right? It's the best interest of their family to make sure they have coverage. The cost to them to cover commercial insurance or marketplace insurance versus the additional income they receive, none of us would make that decision. When we have a workforce shortage, going from 100 to 138, in our most recent long-term care changes we made, it meant somebody going from 18 hours a week of work to 25 hours a week of work. That's like an additional day of care. When we have a shortage of caregivers, why wouldn't we do this? And so when we think about Medicaid and what's our focus, I'd say it's the postpartum coverage and Medicaid expansion are our top two sort of eligibility goals going into the next budget.
Certainly glad to hear that. And it's sad when a state is penny wise and pound foolish, right? I mean, this is a decision that fiscally is the right decision for the state to move forward. And then any additional cost for postpartum coverage gets folded into that. And, you still got extra money left over. I'm amazed at how you have those numbers rolling off your head there, though. What it would mean. Becky, we're not going to leave you out of the conversation here. So just as it's important that we connect eligible disenrollees to Medicaid, ineligible individuals may need assistance in getting other coverage. What's been happening and going forward, what will be OCI's role in helping consumers remain aware of their coverage and assistance options, as well as choosing wisely, because we know it's one thing to apply, it's another thing to pick a plan.
Absolutely. So OCI does have a dedicated consumer affairs team who are available to answer questions about insurance coverage, as well as investigate complaints when appropriate. It's important to note that we primarily regulate the individual and small group fully insured market. So we may not be the right regulatory entity for every question or concern, but most definitely will direct consumers to the right place. And I also want to mention that we manage the wiscovered.com website, and it's a site developed by the marketing work group of the Healthcare Coverage Partnership. Wiscovered.com has information for consumers about finding licensed health insurance agents or navigators who can provide enrollment assistance.
So what role does OCI play in addressing possible cybersecurity threats to consumer personally identified information and private health insurance information? I mean, we know there have been lots of problems in this regard. Now, Wisconsin insurance law requires insurers and other entities licensed with your office. Tell us more about what role you play there, and what are you hearing on the national landscape? What's being done globally to prevent these hacks?
By far, the biggest is getting that information. So as you mentioned, we do have law that requires for entities licensed to develop and maintain an information security program, take certain steps to promptly investigate cybersecurity events, and notify OCI and consumers when a cybersecurity breach has occurred. And in addition to that, we make sure that they're following the plan accordingly and take actions and work with them to ensure the safety of consumers.
We had a question in the chat about the age of the young invincibles. I think we generally talk about them as the 19 to 26 population, which is what's covered in parents' plans. But I think Young Invincibles is an actual organization at the national level that is working in states with young adults to keep them covered. And I think they go up to into the early 30s in terms of some of their targets. So it just depends on whether you're talking about the group Young Invincibles or how we talk about it. And I think that one point to ask Bill about here is that there's a parallel provision in the Affordable Care Act for former foster youth, because we know former foster youth do not have families to fall back on, that's why they're in foster care. And so there was an expansion of Medicaid for the 19 to 26-year-olds. No income is simply, were you in foster care and were you in Medicaid at age 18 or when you aged out at a later age? And the problem is that there was a glitch, technical error in the Affordable Care Act, which required states only to cover former foster youth in their own state. If a former foster youth moved across the border, you didn't have to cover them unless they were eligible under a different category, but you did not have to cover them in former foster youth. Is Wisconsin covering all former foster youth at this stage?
Oh, Trisha, that's a question I have to look into. That's really getting into some of the policy that I know exactly what you're talking about, because when I was working for the DC Medicaid agency, we were going through this exact process, right? Going through all of the boxes as you think about managed care and making sure we cover them. Unfortunately, I don't have that off the top of my head, but certainly something we can look into.
You know, I should have it off the top of my head because I'm working with the Youth Law Center on a brief on this, and we're trying to figure out which states, because there is an opportunity for states to just do a modest 11-15. I don't know why it's not a state option, but it's not. So it's something I would look at, because we know that the 19 to 26-year-olds are absolutely the hardest population, or 19 to 32, whatever number you want to put in there. Those young adults are the ones who are like, you know, I don't really need health insurance. I was with my granddaughter and son-in-law yesterday complaining about men not even going to health care at all. So we think they at least need insurance so that they can't use money as the excuse. So
I will say, Trisha, one of the challenges in Wisconsin is the department cannot on its own submit any 11-15 waivers. We have to have active legislative approval to submit any sort of new waiver. And obviously there is an opinion of some in the legislature that any sort of expansion is expansion. Any
Right.
sort of adding new coverage is expansion, even if we did cover former foster youth outside of the state. I think as a department, certainly interested in it, and I actually look forward to following up with you on options we might have as a state.
Yeah, there is a new requirement. They're trying to fix it, but they're phasing it in by year. So it won't be until 2031 that it's completely phased in, which makes it harder for you. You have to look at the age of the person and say, oh, you're only 18. You can come in, you're out of state, but you're 21. No, sorry. So with that, we only have a couple of minutes here. I'm trying to, we've got a couple of questions. This is really too small on my screen to read, Allison, from James.
Yeah, I can read it for you. With the term Young Invincible, has it been talked about how the younger age group may not know about Badger Care and the programs available? As someone who did not know of Medicaid and food share programs in Wisconsin, I went without health care decade of my young adult life. What is Wisconsin doing to improve education and healthcare in the age range population, in this age range population?
I think that could go to either of you, since not everybody's eligible for Medicaid.
So I talked a little bit about what we're doing, and I know there is a session on this population, and I do believe there are some other folks from the Department of Health Services who are talking about some of our efforts in that space. But to your point, we can only do outreach to individuals we know, right? Often kids who are part of their family who are aging out of family coverage. And so we are making an effort in that space.
Put your how-to videos apply on YouTube and Instagram, and it'll help. Social media is a big thing these days in the outreach world. With that, Allison, I think I need to turn it back to you. We have 1 minute left, right?
We have 3 seconds left, so we're good. Perfect timing. And thank you all. Thank you for bearing with us, especially speakers on technical difficulties. I think we figured it out and got all the information there, and really excellent information. So thank you again. Lovely having you all, and thank you for joining us this morning. So with that, we're going to take a break. Like I said before, you'll need to leave this particular session, go back into the platform and connect to the next session, and hope you will all join us there. And yes, thank you again, and see you in a few minutes.